Spine surgery has changed drastically over the last decade. We've had significant advances in what we call navigation, whether it be using computers or robotic assisted surgeries, more minimally invasive procedures. We're very aggressive with increasing mobility for patients and actually doing procedures in same-day outpatient surgery settings and seeing better results with these approaches. Historically, patients spent about 2 to 3 days in the hospital after spine surgery, and then when they went home, they were usually on bed rest or doing minimal activity. Now, patients are usually going home same day or next day, immediately starting physical therapy and immediately increasing their activity and getting back to their normal activities. If you are considering spine surgery, please contact our office so you can see one of our spine specialists and we can discuss your treatment options and we can see if a minimally invasive procedure is appropriate for you.